I'm here with Sarah Fynmore, a policy coordinator at Sonoran Prevention Works. Sarah, thank you so much for being here today. Can you go ahead and give us a little bit of background on how you got started?
My background's in international relations, and I was studying drug trafficking in South America. I was living in DC, focusing on Colombia and Venezuela and the way drugs move, and then I was down in Chile, focusing on how cocaine moves between Peru and Bolivia and Chile. And the biggest thing I learned was that for as long as there is demand for drugs, there's going to be a supply. So the efforts we take to control supply push demand, they impact demand. We can't just cut off drugs and expect people to recover and not need them anymore. So after I had that realization, I came back here as the overdose crisis was just increasing exponentially. I was like, we need better policies. We need policies that focus on drugs as a health issue rather than a criminal issue. So that's how I came to Sonoran Prevention Works.
Sarah, can you go ahead and explain to us what harm reduction is?
The easiest way to understand it is meeting someone where they're at. It's accepting that drug use happens, it's a reality, and to find avenues to recovery, there's a lot of different ways to do that. There's not a one-size-fits-all, because sometimes people aren't able or aren't willing or don't have the resources or support they need to go into recovery, to be completely sober. So what do we do for those people? We need to meet them where they're at and find out how to make positive changes. Harm reduction recognizes that drug use exists on a continuum. There's significantly more risk for some drugs than others. So when we recognize those differences, we also recognize what behavior changes may need to happen to decrease these negative consequences, whether they be HIV, Hep C, overdose. All of these are preventable, but we need to meet people where they're at in order to prevent them. We need to be thinking about how a one-size-fits-all approach doesn't work. So while someone is using, there are still positive changes that they can make to reduce the harm to themselves. So when we just assume that someone's not worthy of health support or resources or compassion unless they're completely sober, we are missing a huge group of people that need help.
Why are you so passionate about this?
These are regular people who are just trying to get well. We need to be thinking about the overdose epidemic as big as it is, because we all have someone in our lives, family, friends, people in our community, people that we work with who use drugs. It is so important to me that we do not forget their stories or forget their humanity because of their drug use. They're not separate things. You are still a human if you are using drugs, if you are using substances. So why would we deny you a health service so that you can take care of yourself? Why would we do that? That it's incompassionate and makes no sense, especially when we're thinking about the community impact it has. So let's meet them where they're at. And let's understand where this is coming from as well. It's not a personal choice. This decision comes from a need. And there are a lot of different needs, whether that be chronic pain, trauma, whatever it may be. We have to look aside from that and recognize where the root cause is.